everyone, we are Group 4 and our presentation is focused on answering the question of what is the relationship between sleep and mental health, and we hope you enjoy, and please let us know if you have any further questions, comments, or concerns. Thank you! My name is Tian Nguyen and I will be starting off the presentation with a bigger picture. Furthermore, we're going to be discussing why is the relationship between sleep and mental health so important, and what is its relevance today. So based on endless research that has been conducted in regards to sleep and mental health, it has been proven that sleep impacts multiple factors such as depression, anxiety, suicide, and so forth. In addition to that, insufficient and lower quality sleep is often associated with an increased risk of developing a mood or anxiety disorder, as well as a heightened risk of developing suicidal tendencies. Now to talk about some statistics about sleep and mental health. For the first statistic, did you know that 83% of adults with depression may have at least one symptom of insomnia? For the second statistics, 54.4% of survey respondents from a survey conducted by the Sleep Foundation stated that stress and anxiety were the top reasons that they would have trouble falling asleep for. And then for the third statistic, did you know that 91% of US adults with post-traumatic stress disorder, also known as PTSD, have symptoms of insomnia, and 80% of these adults will experience nightmares within the first 3 months of the traumatic events.
Hi everyone, my name is Natalia Gomez and I'm going to be covering the next 2 slides. So in this slide, I'm going to be covering the key points from 3 different research studies that are peer-reviewed. So this first study is called Sleep and Mental Health in Undergraduate Students with Generally Healthy Sleep Habits. So the key point from this study was that the researchers found by understanding the relationship between undergraduate students with healthy sleeping habits and mental health, that we can potentially intervene and improve mental health outcomes before they become clinically concerning. So this is really important in preventing students from getting severe mental health issues. And the second study done was a cross-sectional survey on sleep quality, mental health, and academic performance among medical students in Saudi Arabia. So the key point found in this study was the prevalence of poor sleep was higher among students who were physically inactive and had more screen time. And despite demonstrating higher academic performance, sleep quality was significantly associated with depression, anxiety, and stress among these students. And lastly, the third study done was an association between short sleep and suicidal ideation and suicide attempt among adults in the general population. So the key point found in this study was that a lack of sleep was associated with increased likelihood of suicide ideation and attempt. This relationship is further related to the presence of panic attacks, mood disorders, and substance use disorders due to shortened sleeping hours. And on the next slide, I'm going to be playing a short video for you guys.
Sleep is essential. You can't function or survive without it. While your body is resting, your brain is a flurry of activity. It organizes the day's events and files them into storage so you can easily retrieve them later. It also catches up on housekeeping, clearing away wastes that build up during the day. The more deeply you sleep, the more effective your brain is at cleaning itself. Adults typically need 7 to 9 hours of sleep for maximum brain performance, but many of us don't get it. Too little sleep negatively affects your ability to remember and concentrate. It can also make you moodier and more irritable, and increase the risk of anxiety and depression. In addition, going too long without sleep has similar effects to being drunk, impairing judgment and performance, and increasing the risk of accidents and injuries. Over time, a lack of adequate sleep may also increase the risk of dementia. To ensure you're getting enough sleep, practice good sleep hygiene. Put away electronic devices an hour before bedtime and do something relaxing. Go to bed at the same time each night and wake up at the same time each morning. Avoid stimulants like caffeine in the late afternoon or evening and alcohol and heavy meals before bedtime. Keep your bedroom quiet, cool, and dark. And try to get in at least 30 minutes of moderately intense exercise on most days, which can improve both sleep and your overall health. The better you sleep at night, the better your brain will function, and the better you'll feel.
So after watching this video, I thought it was really important to show and include this video in our presentation because I believe it exemplifies how important it is to get adequate sleep daily in order to allow your brain to perform properly and decrease the likelihood of getting chronic health issues. And for our second example, I included this image of a cycle that happens that starts with a lack of sleep. And so it just continues on. So from lack of sleep, we get tiredness, then we get difficulty coping with daily life activities and results in low self-esteem or feelings of worriness or stress, and then it just continues on and on. So this is a really vicious cycle that really negatively impacts your overall well-being. And just by getting adequate sleep, it helps to break this cycle and just improve your health and mental well-being. And so for the third example, we wanted to share our own personal experiences as a group. And so we all agreed that when we get at least 8 hours or more of sleep, we feel more productive, focused, we have better moods, and overall we have improved mental well-being compared to when we get less sleep. We pretty much agreed that we feel the opposite compared to when we do get more sleep.
Hello, my name is Stephanie Hurtado, and I'm going to be talking about the common research methods and strengths and limitations that come with these methods to study the relationship between mental health and sleep. So for the first method that is commonly used is the self-reported measure. So this pretty much involves surveys and questionnaires that help gather information about sleep habits and mental health. Participants are usually asked to rate the quality and quantity of their sleep, as well as any symptom of anxiety, depression, or other mental health conditions. The second method, actigraphy, this involves the use of a device that is worn on the wrist to measure the movement and activity levels during sleep. This helps provide information about sleep duration and the quality, as well as time and duration of sleep disturbances. The third method is polysomnography. It's a comprehensive sleep study that involves monitoring brain waves, eye movement, and physiological measures during sleep. This can provide detailed information about sleep architecture as well as identifying specific sleep disorders that may be contributing to mental health symptoms. And the last one is neuroimaging. This method involves techniques like functional magnetic resonance imaging to study brain activity during sleep and wakefulness. This can help identify brain regions that may be involved in the relationship of sleep and mental health. The individuals who undergo these methods are usually those who were just diagnosed with mental health disorders or with mental health disorders such as depression, anxiety, bipolar disorder, PTSD, and other psychiatric conditions. Or also too, in some cases, studies are conducted to people who are at risk of developing mental health disorders and those who have a history of family mental health disorders or also that have experienced traumatic disorders. And the goal is to identify interventions to improve the quality of sleep and also the mental health outcomes of these individuals. Okay, so now we will talk about the strengths and the limitations of the methods that were discussed above. So for the first method, the self-reported method, the strength is that it is easy and inexpensive and can also gather large amounts of data at once. The limitation is that there is going to be bias and inaccuracies, and they can be subjected to experiences and perceptions. Obviously, people can report false information when they are answering those questionnaires and surveys. So this method is probably not going to be the most accurate. The second method, actigraphy. Actigraphy, the strength is that it is inexpensive and can be used to collect data over an extended period of time. It is also a minimally intrusive method, and as it does not require participants to visit a sleep laboratory, like another method that we will discuss in a little bit. The limitation is that it is not able to distinguish between different stages of sleep, which is a very important factor to understand the relationship of sleep and mental health. Excuse me. The third method, polysomnography, is considered to be the gold standard for measuring sleep, and it detects specific sleep disorders that contribute to mental health. Also, one of the limitations is that it is expensive and time-consuming, and this method does require participants to spend a night in a sleep laboratory, and the data gathered may not reflect their normal sleep patterns because they're going to be in a very unfamiliar environment, and it's not going to be in their normal, comfortable environment in their own home and room. So for the fourth method, the neuroimaging, the strength is that it provides information about brain structure and function during sleep. It identifies regions of the brain that are involved in sleep and mental health, and this helps make targeted interventions for future cases. Also, the limitations is that it is expensive and the data collected can be difficult to interpret as changes in brain activity can be caused by other factors and not just sleep and mental health.
Moving on to the implications, research shows that not achieving enough sleep or lower quality of sleep can increase a risk for mental health disorders. Sleep is critical for physical and mental health. 7 or more hours of sleep is necessary for an adult. A healthy diet and regular exercise is also recommended by the American Academy of Sleep Medicine. They recommend that adults should get between 7 to 9 hours to function in a healthy state. Teens require more sleep, which ranges between 8 to 10 hours. There are studies that show the lack of sleep can increase the negative emotional responses to daily struggles. In this study, they measured the responses, which included feeling ashamed, nervous, angry, and restless. The lack of sleep can increase anxiety, depression, and suicidal ideation. Many of the studies observed include nurses, college students, and people with sleep disorders. People with mental health disorders experience insomnia and lower quality of sleep and continue to struggle with suicidal ideations. This study was measured by the CDC, which included adults aged 18 to 65. Researchers were able to determine that inadequate sleep is a risk factor for frequent mental distress. And now we're moving on to the potential research questions. One of them includes, how does the quality of sleep decrease in older adults? The geriatric population increases and the prevalence of sleep disorders also increases. Actively trying to research this question can lead to some new discoveries in medicine. The CDC estimates that 50% of all Americans will be diagnosed with a mental illness at some point in their life. Mental health disorders have become common in the U.S. Nearly 1 in 5 of every U.S. adult currently lives with a mental illness. Another question is, in what ways does a sleep schedule differentiate between those who come from a lower socioeconomic background and those who do not? The lack of sleep has been shown to contribute to poor performance and mood disorders. They contribute to the poor outcomes and lead to obesity, hypertension, and type 2 diabetes, and premature mortality. Another potential research question: is there a significant relationship between the American work schedule, such as a 9 to 5, and the mental health of Americans? Americans are notorious for working long hours compared to other parts of the world. The American Academy of Sleep Medicine is actively trying to eliminate the biannual time changes in March and November, commonly referred to as daylight savings time. They stated that the change conflicted with the circadian timing and disturbs the routine that people may be on. Some recent changes that the American Academy of Sleep Medicine is actively covering also includes later start times for public schools. Another potential question is what environmental factors impact the quality of sleep for people living in low-income countries. Many people of color have historically lived in disadvantaged environments and are exposed to circumstances that affect sleep. This results in dysregulation and an increase of the risk of obesity and other health problems. Another question is how effective are the recommendations that physicians make regarding sleep? Physicians often miss treating issues that surround sleep loss. These comorbidities put patients at risk of cardiovascular events. The importance of an interpersonal approach to ensure the patients are able to acquire adequate sleep. A potential treatment plan could also include an increase in the quality and quantity of sleep.